But because of one or two reasons, technical reasons, I mean, we start with it. We're sorry about that. We will call on Dr. Adeyemi Rollins and me for really welcome my hands.
Good morning, everybody. I want to welcome all here this morning on behalf of the management of board management of Paving Breast Cancer Foundation. Bring my greetings from the director there, Secretary Dr. John Shepherd, this Barbara Shingari. We have sent our best wishes for a successful event. We continue our fight against cancer, which is becoming inflamed every day in our blood forming survey. So it is confusing that we are able to put together this event that we are attending to ensure that we keep new people alert to what issues are that around cancer, and specifically breast cancer. As I look around, we have come from various walks of life. Some people coming this far. I hope with the benefits and the joy of spirit, you'll also feel how to be here. I want to remind all of us that at the moment in the country, women and girls are facing very difficult challenges because of breast cancer. So that's why we are engaged on defense campaign, prevention, family protection, lifestyle changes, and we will go straight forward. We teach you how you can check your breast when you're home at home. It's very important that when we have to do it, you take advantage of your plans and available to life with it. You will see your self check, you will give eye check, you will give family check, you will give prayer check, and lot of others vitals you need to do as the trial you enjoy a good life. Also, especially for women, you know, but cervical cancer is also linked. But what the attention can correct age and around that works. That's that. We are going to be pregnant, infertile, throughout the period of the year, and make sure we're trying to best answers what's after. Also, what's the cover of the name? The name on the level to date. Prostate cancer also affecting our life. You see, the devil, you got not very important how to be the blood cancer. We should not say, because today, the place will feel to us as many person as well. Thank you.
Thank you very much, Dr. Sadi. We're going to call on the CEO and founder of HME Breast Cancer Foundation, Mrs. Mela Paving for giving a message. Thanks. Distinguished guests, welcome everyone. We apologize again for the late start. You know, some things are beyond your control most of the time. Thank you very much. We're here today. It's October, and October is Breast Cancer Awareness Month. We're here to raise awareness We are here also as women and men to be screened. To be screened so that we'll know our health status, which is so important. I welcome also the members of the right table, of which on my right here I have Dr. Ahmed Ruri, Ali Ruri, who is from the Ministry of Health. I have with me also a rep from the WHO, welcome you. I have a lady from the military, Asla, welcome again, thank you. And we have WHO rep here. Orange Foundation, welcome. And last but not least is Dr. Sahim, a board member, Thinking Pink, Chairman, Chair. So these are all the members of the high table. This is a health fair, distinguished guests. Let us remind them that October is Breast Cancer Awareness Month, and our data clearly points towards, especially girls, who are showing up with lumps, with abnormalities. It's sad that we cannot have our projector out so that with your own eyes you see the data. Because it's about the data, it's about statistics. Statistics speak volumes. And that's why I took my time to introduce the high table. Because it's such a blessing to have Ministry of Health here today. They know we have been kind to them for the longest time, so that cancer can have the attention that it truly needs in Sierra Leone. When we are talking about the data range, 0 to 19, 20 to 29, is very high. And this should be so unacceptable because these are our next generation. And if they start getting this kind of sickness at this kind of age, it is not a very good. Not all lumps are cancerous, some are benign, some are malignant, but indeed, girls are showing up with malignant cells that is even costing them morbidity and mortality. And so we are happy you took time out to join us, our partners. We can see Olia here. Access Bank is around. We have a cycling association, of course, ASLA, and we have an Irish aid with us, the Irish representative of the Irish Embassy. Thank you for coming. And also, we are all distinguished here. We have some of our survivors. We have some who just came along just for a breast check or just for a health check. Be patient after this ceremony so that you'll be screened. We did this for you. So don't say, oh, I'm in a hurry, I have to go, and then they will say, no, just patient away. Make yourself go home, stay, and not say, oh, may the diabetic test good, may the body check good, may the eye good, or check each way anyway where you come out. Okay? Let me pause and say thank you. Thank you especially to our donors and partners who have made this very important event a success. Because for you to come is a success. It makes it a success for us. You made it possible. You are the ones who have this event. Because too many women, they will come to our clinic, they can't afford their own clinic, let alone all the things we have lined up for them to do. Thank you, partners. Thank you for making this such an important thing for women. Because too many women are being screened and it's late detection. Why late detection? Their awareness is slow, it's very low. Because if women come to this 21st century, on this October 20th day, 2023, are coming forward with late detection. That tells us that the awareness is low. Because we know we have been very noisy all of October, visiting the schools, marketplaces, deprived communities, corporate houses. This raise awareness. So each someone, when you meet here today, take this back to your community, take it to your church, take it to your own girls' association. Because as we all are here, each and every one of us is at risk of breast cancer. What is breast cancer? We have the medical experts that will go into it for you. But then, breast cancer is the uncontrollable growth of cells in the breast. What? Cancer is multifaceted, meaning it can affect any one of our organs. So when we say breast, also think about the cervical, Dr. Salin spoke about that, the men, their prostate, think about your mouth, eyes, the brain, skin, blood, anywhere that has an organ. Because it is the cells that becomes tissue and tissue becomes organ. So this is how we are created. Trillions and trillions of cells in our body. And so why should you have cancer and the next person doesn't? This is just genetic or lifestyle or hereditary. But in our organization, we always raise awareness about early detection. Because if it is caught early at the onset, when it's just like the head of a pin, or like they said yesterday, the broken peanuts, and you check and start treatment early, you may survive. You can survive. But when we leave it and try to do it our own way, taking antibiotics, going for local treatments, applying mentholatum, hoping that it will go away. 1 month has passed, 3 months has passed, still doing the same. Change from mentholatum to antibiotic, change from antibiotic to local treatment. You are progressing and cancer keeps progressing because maybe your lifestyle, maybe during that period you're still smoking, during that period you're still drinking, during that period you're still eating a lot of sugar, salt, fatty foods. These are all the things that are the risk factor. So please take care of your health. You're here today to learn 1 or 2 information. Be breast aware, take care of your health. Once your health is messed up, your mind will be messed up, and because nobody likes to be sick, and sadly, we live in a country where the health infrastructure is not as it should be, as we would like it to be. Yes, we are trying, but we are still not yet there. And so, let us be breast aware, and let us also take advantage of this event today. Explain, know your health status. Every year, everyone should go for a physical, so you know that, okay, I'm borderline diabetes. That means I have to slow down. I have to start exercising. I have to change my lifestyle. Or they notice a lot of abnormality. It could be a lot. It could be a rash. It could be tickling. It could be discoloration, change of size. Pay attention to your health. And one way health we get, and one way life we get. And so I thank you all so very much. I hope we will have a very fruitful event. And thank you for your time. Thank you for your partnership. Thank you for your sponsorship. As together, we can find cancer in ceremony. Thank you.
Thank you so much, Lucy, head of Athletes and Grants, CEO and founder of Paving Breast Cancer Foundation. Now, people used to say, "He feels it, he knows it." And now we want to get a survivor story. Somebody wey don't go through, somebody wey dey go through breast cancer. So at this moment, we call on Memona to Sally for cancer reading your story. Narok Dakwa. Injection volumes.
Now, good morning. About Windows 2020 is going. We are going to say, well, the games program, talking about the series, theories. So, we found out the having the available the streets, right on the screen. So, they can't see anybody, they can't know, say, but the first person, the young people, job or restaurant. So where I come, when we find the occupation, I'm not there. When life found my survivor, so I like all the get the car, and live out normal, so I try to encourage people to get. If you not say you get some, I will come, give them on the office, without the screening and permission of you, nothing, nothing. So thank you. God bless you.
One thing is he said when you feel out of banquet, because you see in resident and because we can't feel. You know, she stage they get for going to accept you. They just do compare to me, pull it up, and stitch them down. All right, so we'll call on Maria Majulisa for let's say your story. We will carry on and we will learn here. If you come, then you can insert your story. Now we will go to the presentations and we will call a representative from Orange Foundation Scenario focusing on the importance of partnership.
Thank you very much. Standing on the existing protocols, good morning, ladies and gentlemen. I bring you all greetings from the CEO of Orange Sierra Leone, Mr. Sekuba, and the Director of the Foundation, Madam Justine Events. Our partnership with Thinking is a great opportunity for us as we continue to serve humanity. It makes stories like the one we just had possible, and we are grateful for that. Aside of being a platinum sponsor, which Orange Foundation is, we have been very active in this month's event. For example, our team have always accompanied the team from Paving to go to different locations to enjoy the breast swimming. And in the coming weeks, we're going to the province as we further demonstrate our commitment to fighting breast cancer. Ladies and gentlemen, without wasting much of your time, we're calling on all to become a partner. And how can you become a partner? By spreading the word. Lemuna just said she never knew about cancer, or she noticed something, she got the information that she can come to the Padeva Road, thinking she can be screened for free, and she got an equation done. So every one of us here can be ambassadors. Go out and spread the word. Because what I have come to realize is that the most important thing about breast cancer is early rejection. Once it is detected early, like the case of a young lady who came up just now, your chances of survival increases exponentially. The other side of that is if it is not detected early, if it is trying to be managed at home, or you try to go seek prayers, or you try to go seek fetish help, it only gets worse. I believe in the power of miracle. I believe God can heal. I also believe God gave wisdom to science. God gave medical doctors the wisdom and the expertise to deal with some of these things. So, ladies and gentlemen, again, it's an opportunity for us all as we continue to stand together in human and in the in making sure that this message gets to the farthest place we can get to the world. Let's be the roots. Let us all become part as we spread the word about cancer. Thank you very much.
Thank you very much. And now our keynote address, and the person to deliver the keynote address is the team lead for the LPR Coordination Cluster and Technical Officer for Nutrition and Food Safety in the World Health Organization. Let's put hands together as we welcome and organize. Dr. Vincent Bright Maria, who will not to be part of this session, but is engaged in another very important activity of public health. Breast cancer is a disease in which abnormal breast cells go out of control and form tumor. If left unchecked, the tumor can spread throughout the body and become fatal. October is Breast Cancer Awareness Month, an annual campaign to raise awareness of this complex disease. This month is set aside to promote screening and support patients and families of breast cancer. It serves as a reminder on the importance of regular breast examination and mammogram to detect breast cancer at an early, more treatable stage. The pink ribbon color is a symbol of hope and strength for those facing breast cancer. Globally, breast cancer control is a gender equity and human rights issue. Breast cancer has become the most diagnosed form of cancer, accounting for nearly 12% of all cancer cases worldwide, and is the leading cause of cancer death among women, especially in low and middle income countries. There is more than 2.3 million cases of breast cancer that occur each year, which makes it the most common cancer among adults. Women are at high risk of breast cancer. Approximately 0.5 to 1% of breast cancer occur in men. The treatment of breast cancer in men follows the same principle of management as for women. Certain factors increasing the risk of breast cancer, including increasing age, obesity, harmful use of alcohol, family history of breast cancer, history of radiation exposure, tobacco, and post-menopausal hormone therapy. In Sierra Leone, access to and the available of standard breast cancer treatment is a major obstacle to improving breast cancer outcome. Patients might not be able to complete the full course of the treatment for a variety of reasons, including inadequate access to unaffordable out-of-pocket expenses. Incomplete treatment leads to poor patient outcome, including recurrence of death. Lack of treatment condition also negatively affects quality of life. Patients suffer the side effects of treatment while it is ongoing, but do not have the possibility of receiving the full clinical benefit that it has to offer. WHO in February 2023 launched the Global Cancer Initiative Implementation Framework for assessing, strengthening, and training of services for the early detection and management of breast cancer. The objective of the WHO Global Breast Cancer Initiative is to reduce global breast cancer mortality by 2.5% per year, thereby averting 2.5 million breast cancer deaths globally between 2020 and 2040. Reducing global breast cancer mortality by 2.5% would avert 2.5% of breast cancer deaths by 2030 and 40% by 2040 among women under the age of 70. It recommends for countries to implement the three pillars. 1. Health promotion and early detection. 2. Timely diagnosis within 60 days of initial presentation. And 3. Comprehensive breast cancer management. By providing public health education to improve breast cancer awareness among women of the signs and symptoms, and together with their families, will understand the importance of early detection and treatment. More women will consult medical practitioners when breast cancer is first suspected and before any cancer presents is advanced. This is possible even in the absence of mammographic screening that is impractical in many countries in present time. Public education needs to be combined with health worker education about the signs and symptoms of early breast cancer so that women are referred to diagnostic services when appropriate. Rapid diagnosis needs to be linked to effective cancer treatment that in many settings requires some level of specialized cancer care. By establishing centralized services or hospitals using breast cancer as the model, treatment for breast cancer may be optimized while improving management of other cancers. As I conclude, I want to reaffirm that WHO is committed to work with governments, the DPP, and other partners in raising awareness of early diagnosis and screening for breast cancer. No one should face breast cancer alone. Let us team up to detect breast cancer early, diagnose it faster, treat it better, and give everybody with breast cancer the hope of a cancer-free future. I thank you for your attention.
Thank you very much for that keynote address. We will continue with our presentations and we will like to call on a very seasonal health worker that has passed through the ranks in the Ministry of Health for medical officer, who worked at Connors or Adrian Hospital, that we call, and Macaulay Street Hospital, which he opened as the first doctor. He went through this chief medical officer, program manager, and director, and now is the deputy chief medical officer, public health of the Ministry of Health and Sanitation. Let's put hands together as we welcome Dr. Olukis Bolu.
Thank you, Madam Chair. Madam Chair, Count of PPP, members of the High Table, distinguished guests, and persons from the fourth media, I bring you greetings from the Minister of Health and Sanitation. Now we are pleased, as always, to be partnering with PPP when it comes to addressing cancer management and cancer issues. So, Madam Chair, please permit me to switch my statement into the Liverpool past bill because I'm seeing my mothers here, I'm seeing my babies, and I believe if I go to the hill, our brother and sister from China will understand a bit. Changing. Family, we are the Ministry of Well Body. We try to partner them because we know say we want to know the able for push the well body business. And when it comes for cancer, the board are not hearing from the other speaker when we don't talk. Cancer and sickness that one way in our people part of based on the part of the body we all must the name when we reach the cancer. For us, Madam Platt, they remind me this funds will not be so long. And we want that way we always live our body business and the world. We will not have this low put out check-up fast before you know from small area you don't want to like go to the part of that organ. And if the rat gets you, they will go on that organ inside there multiply, scatter and the body. So far, I the one who want the also be a even the top of breast cancer. Cancer generally to get over 19 million people there to really get cancer every year. I will not read the statistics for breast cancer. For Sierra Leone, last year alone, to get over 900 women we were diagnosed for the first incident pregnancy for the world. For the cancer generally, he says alone, will detect over 4,000 cases last year. So that you will not say the neighborhood, the neighborhood too. And in fact, I believe say this number before past this one, if people in the town early for them to diagnosed. And the number of people already for die, the not for which number they could detect quick, so that we able to detect early, and that's how we detect early. We be able to make a quick for them to not scatter and make no above the life. You see this young lady we can't talk Jesus. This not to consider say we are real former. And look at the age, very young. First time will not be the same kind of things that are amongst young people. But now we see for many reasons. I will touch small but now before I come to the area we have it to. Who are going to talk on the gap. For many reasons, we see now it is very hard. One, now we get where we will detect them. We're more improved now than how we can detect them before. So now, even for the gas at the slope I use and you don't able to detect at the early stage. So when you can't pick, you begin to feel something that you don't. If you can't pick, you get the visual and you will detect it now early. Number two, not to all man over that. That make at the life where we are partner and they join us for long to spread the message. So that people that were able to detect are on their own. Because when you're able to detect that, people even remember saying not easy. That will make you go see doctor. Or you kind of one of them staying in place like people like that. And then we will detect that with a manager. The last time, in this standard, thrown at the bar of your stomach all night long, you may see the decision. Then they compete among themselves. That's not a very risky lifestyle. I want to tell you now. And I want to see this opportunity for a facade. See, not a good lifestyle, I want to make a problem. If you're a young lady, young man, where you don't struggle for educate yourself, you find like you get a good life where you will enjoy life usually for a long time. Not expose yourself to the risky conditions in it where will make you get higher risk for less cancer. Look at modern lifestyles, of course. But I just want to focus on smoking, alcohol, consumption, and low. See, all it down will expose you for cancer. Family, and especially the woman, use yourself to check on you where you need to move. I go on left last side, maybe something that will get demonstration. For that demonstrate to woman, how we will check on the body. You find where you go for works. At least once a week or once a month, check your body. Check them and see if you get small bump, what they call Lord. As the below said earlier, not all long will be to bless cancer, but finally you check. When you check for yourself, you feel something in your body, any one of the two body, not quit. Let nobody know who's scared with the sickness. Not quit at the place. And not shame. Because not to take for shame. Go to the hospital for the facility to see the slim woman for that. Go meet the government woman during the home. Talk to them. They will skin you, they will help you for skin, and they will tell you if you get along. And that long will you get. If I just walk normally in home, or with the promoting staff, if I train you need to pass. When you take that step, you need to situation that if that's our people, they will be able to take that iron and they will say for to tell them how long you can explain you now. And that long lady, you don't already take care of everything to go for going on my life because they'll be able to take them iron. For the one away, they're not able to take them iron. Sleep not shame for one hour hospital. Why? Because you don't need to stay away for shame. Westerners are we keep at saying, moment for which you not will. That's everyone. If you shame for more and moment for which you will shame for slow Nigeria. Because when you slowly, not only one more will not see anything. You want every day and you will see everything. So don't wait till you reach that stage. Go in the moment where the will help you. And we at the Ministry of Health will get the facilities available for help. For people who should now last is the opportunity for talk about what everyone like I tell you. Without the whole case, that's not true. Inside salon, why would those who not get all the facilities and the cancer? we dey make sure say when people in the camp, citizens in the camp actually say the doctor don diagnose say get the cancer, we dey come in for support. And many times we dey meet people, partners and individuals, and I want to see some opportunity for us join the partner everything on behalf of the Ministry of Health for tell partners and anything. I do pass the message to the embassy and the Chinese delegation. Please pass the appreciation to the ambassador about the support that you are giving to us and our partners in the fight with cancer. And also with the other partners, Orange, and the other partners, the local and international partners. Of course, we go season, we will see how next to next, where the village, how they put and hand for pets all the business and this country. I would appreciate them on that. However, the ultimate at the same time for make us stressing, we find make una know how to detect this breast cancer, woman in particular. Let una know when to take the legs, but because at the moment we not strong it as a country, we don't get all team on what for manage cancer. Number one, we diagnostic machine the way we get, and now we get perfect for any new one. Plus also, now we wanna give the responsibility for our body business. And we will tell you, over the years, we'll get problem for now we get new diagnostic machine. We will make we detect the secret. When woman get long or man suspect something for the prostate surgery, we take sample of that long way. So get the technicians waiting for you to look for the machine and all the first we send them out. It can take 6 weeks, sometimes some lesser, before the results come back. For now, address or for now we know if this long how they receive na cancer or not to cancer. Sometimes even though we don't know to one study that you tell us we will not get enough facility. First will pay for that person for make they go out. And cancer, not to the doctor normally to go operate to. You get a whole team looking at each cancer patient. For people that don't diagnose you get cancer. For breast cancer, we get for cervical cancer, we get prostate gland. Stage the issues are not to cooperate. And because we go do when you tell us the passing, so they will start to what we call them, will take out the other will be injection. The one that they said, and now we begin to develop that thing. We're not struggling for the other. The other gap we will get as a country, now that service for cancer, the knowledge, the information. If you ask, you will go normal in one kind of speech, you ask the copy woman. Let it show you how to check for this lump at the body. Not to all man, not to all women, but everyone. Not to all man get information, but how to examine yourself for get cancer. And not to all man they know so when you get up, not go begin saying, then that before be the watching, it's our be the watch. If you carry yourself will be the watching. 1 month after that, I begin see that spot now. So tell that watch will be the watching. They go begin question about other person. Instead of let go to hospital, they go begin saying I do the one door. From there, they will go to traditional healer. Traditional healer back home will say because of tell us They don't get that knowledge they for sister cancer, you give up medicine for whatever, you give smoke the body, you find you make a worse. Continue 2 months for them progression tell at 2 weeks. Before you know, so long of woman. So that's a big business for the cancer. The number of whom, Madame could lie back home after the self. Because as I said earlier, our moving power produces and is will not say the whole poor. So we join them with the partners. So I mean, even when they say to organize the game program, they are all for that. Because we don't say that they can do for you, you don't spread the information. The other problem we get when I did that, like the corporate business. We also say corporate business is right now. So man, you need a nice for itself and problem. The salary not do. Then the target sick way is saying for go buy the medicine, it will be very expensive for. Or for them go to the test normal say. By the time they don't call the amount, they do not from hospital, not the really. So that a big gap we will get as a country. The other gap we will get over the years will not get any special hospital in the corner country. Where you will say this hospital now for managed cancer. Instead, so many already gets belong for operation are common in the century surgery. If I begin with the seven hour ability, womaness of the seven appreciation. So never that the one who gets. However, we get good news. As the Ministry for Equality, we not stop like people saying this and that, which would not use of me. No. As a ministry, first of all, we get a partnership with the partners. The International Atomic Energy Agency. We need the support to be very strong for now establish a facility there. We get all the international partners like Mark, pharmaceutical and others. So we need discussion and engagement now to the very advanced stage for them giving some of them equipment that are able to begin the diagnosis inside this country now. So that we're not going for way take it over. And families will have. So and the other good news is, as we mentioned earlier on, will not be get a hospital where we mainly for sisters. But the good news we are getting from our community is that now we can get a special hospital just for management of cancers. And not to say, we'll keep on giving the hospital, no, we're not wait for that. Rather, the hospital they on our way Amakoli Street Hospital. The new hospital in the lobby Amakoli Street, doing 100 beds. we dey can convert am just for the management of Christ. Among them including Christians. I no dey hear like this. And honestly, we no dey wait till the hospital done. As I mentioned earlier, we don engage already with partners like the International Atomic Energy Agency, with other pharmaceutical agencies like MAC, for now we get the latest diagnostic machines wey we dey build am so that we sef go dey at par with the other countries on diagnosis. And also, we not only dey wait till the hospital don before we sef. At the moment, as we talk to now, we dey perform the oncology team. Some of them dey oncology at the moment as the major of oncology shake you. Thank you for endorsing. We'll get a team of doctors, team of business scientists, team of laboratory scientists, and radiologists. In fact, yesterday we just talk about endorsing another doctor for one who study radiology. So that by the time we will not rehabilitate the hospital, we will get a team who will start for work with Allah. And we're not only left them on their own, we're also not going to partnership with other advanced hospitals abroad where they ready for send the specialists to come mentor young doctors in Ghana so that we will begin diagnose and treat good cases in Ghana and the thoughts. And by God the power, it will happen. The other thing we don't do for addressing them as it is, we will work with close partnership with the partners. And we will continue for collaborate with them. I remember some time back, this father would have said, we know this slow. Now, we know, I remain this. Like what's in Ion, the leader talk like that. We know about that. In many instances, the rest along time and itself. To say that the world will talk to partners like the Chinese people that they open. For them, they support, for them, we don't tell them, for them, they do operation. And the woman will not discuss it. The wonderful actually for that. Like we will continue to collaborate with that kind of partners there for all procedure for the easier, especially for the woman. Again, as a ministry, we not only open the hospital and never for treat cancer, but we also God established a national program for cancer control. To be able to that program to do all the work we get for look at cancer issues like that for health, for now develop protocols for treatment, for now look at the strategic ways we will address the various cancers that we get in the body. So as a ministry for a body business, so they see this opportunity for law continue for tell say, and especially the woman. So we know they take on a business rights, especially when it comes to cancer, breast cancer in particular. But I also want to say, after the breast cancer, we're going to see the blood of the highest form of cancer over Salon, really above the 60s of this country. One of the things they go on is no worrying. The cervical cancer every other year. That cancer will affect the cervix of the woman. So because of that, we don't want to wait till after the day to turn them in our treat power. So what we don't decide to do as of last year, to remember, we carry the vaccine package, go on this reading, go give them, we're not 12 years in it. Go on package, all them are looking at it. What you do, before that market say, go on page 2. They help them begin and then when they go, Whether we don't turn adults, people wey dem begin attend their day business. We go don remove the risk, but then dem no go get cervical cancer again. So we will continue not only picking the whole magnitude last year, legal picking the whole. And the next 20 years, we will continue with that. For magnitude, all the younger people now. And the next 20 years and above, from 20 years going forward, we're not going to work again about cervical cancer. That's the way. Because we don't mandate now that all for protection against cervical cancer. So the message from the Ministry for Equality is we are the woman in particular, this cancer and the body, not to do it for shame box. If you check the body on you, you are want to read the words, or wait in the morning, go before the day on itself. Check this the body. If you read something in a small book, not big, because when they detect that adding like anyone as a suitable man, go early. Even if you fix it on the phone, let the doctors go tell you what they will do. So with that, I want to wish all the women inside this month to get cancer free and then the food free for them to go check over. God bless you.
Thank you so much, Dr. Alewuli, from the Ministry of Health and Sanitation. Now we want to know about the state of cancer in Sierra Leone, and we'll call on Dr. Khadija Kone, our oncology nurse, to give us the state of cancer in Sierra Leone.
Chair Lady, National Person, members of the High Table, distinguished guests, ladies and gentlemen. My name is Khadija Kone. I'm a red counselor. I had a short presentation, slide, but unfortunately I couldn't show up here. So the state of breast cancer, cancer here in Sierra Leone. I would say that, I'll make it really short. The prevalence is pretty high, yes. So far we have detected so many breast cancer cases here in Sierra Leone, alongside with other cancers. The most prevalence of all breast cancer, all the cancer is breast cancer. A lot of these patients comes to us with late detection stage. Some patients come up to our clinic with early cases. Some others are just confused and just want to know their status. So they come to us to check their breast, right? We go to various places like the Connaught Hospital. They go down to Thinking Pink and various other clinics, right? However, the management pathway of breast cancer is still forming, but so far we have achieved some milestones, and some of them is there are plenty, but I will start by saying there's a cancer clinic established at the Connaught Hospital, which is hosted there every Friday, and we get about over 30 patients who have some sort of breast abnormalities and other form of abnormalities which are highly suspected as being cancerous, right? Or being a cancer case. So they come and see this doctor. However, at the Thinking Pink Breast Cancer Foundation, we go around, we go to different places on our outreach program. We assess these patients who have breast abnormalities. We also assess those who come forward and are just willing to check their breast. And we ask them questions, right? We ask them, how have you come about to know about breast cancers? Do you know any signs and symptoms? A lot will say no. They don't know much, but just after sensitizing them or educating them, if their level of knowledge with regards to cancer has gone from, let's say, 2 to 10 out of 10 because of sensitization, right? And nurses, all individuals are very important in the fight against breast cancers. No one is left out. Each and every single individual has an important role to play with regards to raising awareness and sensitizing about breast cancer, right? Because you can never know. You might just come across somebody who is nowhere near a hospital facility that is, having some sort of abnormality, and you'll be able to guide them and direct them to the right channels of treatment, right? So we get so many cases that are referred down here at the main Connaught Hospital, sometimes down at Paving Breast Cancer Foundation from the provincial areas such as Connaught, Cannon, Makini, Boone, Kailam, and many more. And unfortunately, some of these patients come in with late stage. So their treatment pathway has to start as soon as possible. Some of them had a full-blown localized malignancy. That means their cancer is basically localized and they needed fast treatment. Then the treatment pathway starts with awareness raising. So when patient comes up, let's say to Thinking Breast Cancer Foundation, we not only check their breast to understand their grade of status, we also educate them, first and foremost, and their family members with regards to breast cancer and possible treatment pathways they will have. They get sent to like this oncologist, medical and the surgeon oncologist we have here in Sierra Leone at the Connaught Hospital, who will further request investigations. And these investigations will be done to determine their status of breast cancer or to what extent breast cancer has spread. And their aim, the treatment pathway starts, right? So basically, cancer or breast cancer, to be specific, has to go 3 types of treatment. Actually, there are 4, but let's focus on the 3 right now. And these 3 treatments, the first is surgery. Majority of women with breast abnormalities presented with lumps or swollen breast, it starts out with surgery, right? A surgeon will assess them, book them for an operation. After, of course, one is various tests, right? When they get this lumps removed or this malignancy, another pathway is that a patient comes in with a swollen breast. A fine needle aspiration is requested. This is a procedure where a syringe and needle is inserted into the mass or the lung, and a little sample is withdrawn and get it tested. The test is called histopathology. And this histopathology can tell us what cancer it is, right? Or how far gone the cancer has developed. And then surgery will follow through. And after surgery, they take a couple of weeks to recover from the surgery. And then the doctor, the oncologist surgeon, or the medical oncologist would then further prescribe for them a chemotherapy. But unfortunately, we only have one pharmacy that only provides chemotherapy for a large number of cancer patients that are coming up, and that is City Glow. And we hope that the government will do something about it so that we can have these chemotherapy drugs provided in various pharmacies and also as a cost recovery, not only through a monopoly pharmacist, right? And they get these drugs and they come back to Connaught Hospital where these drugs are being administered, right? Some patients can take this chemotherapy for a couple of months, such as 3 months, 5 months, sometimes up to a year, be on these chemotherapy drugs. Depends all on the severity of the cancer they have. And after going through all this treatment, ideally, the next step that follows is radiotherapy. Unfortunately, non-existent here. So it's left with patients to sort out fundings to travel out of countries to sometimes the sub-regions such as the Ghana or Senegal, sometimes Ivory Coast, and even some of them do travel all the way to India for this radiotherapy, which is a key treatment in cancer. In order for a breast cancer case to be a successful case, radiotherapy is so important, but unfortunately is non-existent. So the patient is left with nothing, no chemo or radiotherapy, but just stop at that stage and will have to then try and further their treatment through other means such as the hormonal therapy, right? And that's the fourth treatment that comes into place here. It's being offered here in Sierra Leone. It's a sort of drugs that help some of these cancers that feed on humans, our natural body's hormone, to basically starve this cancer of this hormone so that the cancer will not develop and progress. I would say so far, for the past 10 years since I started working as a nurse, I've seen a lot of improvement with regards to cancer treatments here in Sierra Leone. 10 years being with no oncologist surgeon, with no medical oncologist, with no oncologist nurse, and basically no place of treatment for cancer patients, let alone referrals. But now we have an oncologist surgeon, we have a medical oncologist, we have a nurse oncologist, and we hope that we get more of them because one is not enough to serve a huge load of people with diagnosis of breast cancer. I say people because it's not only women that get breast cancer. Men too get breast cancers. And they equally follow through the same treatment pathway as the women does. So, ladies and gentlemen, I would say we've come a far way, but we still have more obstacles and more gaps to fill in with regards to cancer treatment. As a lot of women are still dying because of, incomplete treatment pathway. However, we do have some success cases. Women who have undergone the treatment facility provided here in Sierra Leone, and they get to stay, free of cancer for a very long time. So far, we had a 3-year survival rate, which has even pushed through to 5 years now. Some patients I've known who were diagnosed then and are still living, coming in for regular checkup and screening and going about their normal days of life. So, ladies and gentlemen, thank you very much. Next. Okay, so apologies again. I'll just spare another 2 more minutes to just show you all some of the best ways to prevent or be able to detect any abnormalities in the breast. It's called breast self-exam, and the name simply implies that you can perform your own breast exam, okay? And it's very simple. You literally do not need any gadgets whatsoever. You only need your hands and perhaps a mirror to be able to observe what's happening or what your breast looks like. So, ladies and gentlemen, if you can all join me to perform a breast self-exam, this is an opportunity for so many again to learn how to do the breast self-exams. So the first step one can do is you remove, I don't want you to remove your tongue. Just imagine you're doing that, okay? So you expose your chest or your breast, and you stand in front of the mirror to observe any of the signs. A couple of signs are like swelling on the breast, changing the shape of breast, discoloration on your skin, or if your skin has an appearance of an orange peel, not a good sign. Look at your nipples, they should be pointed outwards, not inverted inwards. And then also look under your arm by raising your arms over your head to observe your underarmpit and also around your breast area. And now we come to the checking of the breast. So it's going to be difficult for me to really perform breast exams, so I'll ask my wonderful lady to hold on to the mic for me so I can simply show you. And if you can all join me to do such, I'll very much appreciate it. So the first thing you do, sorry. So I'm going to come down to the middle. This time microphone for me. Yes. So basically what we will need to do is this is fine, okay?
So what one will need to do is, let's start with checking the right breath. If you can all can follow me, let's do it together. One, okay? So you take our right hand, put it on top of our hand. Then we use our left hand. Now, it's the three middle fingers is what we're gonna have to put together and start feeling and detecting the breath, okay? So you start around the collarbone area, you move down the chest towards your breath. You start moving around your breath, apply firm pressure. Because what we're trying to find out is any suspicious lump, but not only lump, also an abnormal thickness, right? You feel all over your breath until you get behind your nipple. The next step is you go in your armpit, lower your arm a little bit, yeah? You feel for this enlarged lymph nodes, which is something like a lump again. But after that, you come down to your breath and you squeeze your nipples, right? Because you want to see what discharge comes out, maybe for the women. You squeeze and you observe what discharge comes out. Mind you, if the discharge is bloodish, if it's brownish, or if it's mucus-like, then that is a problem, right? So you completed checking one breath, but we don't stop there. We have to move to the next. So we do the same thing one more time. Left hand on top of your head. We use our right hand. Start applying pressure. Yes, you have to apply more pressure as you get to a fleshy area. Apply more pressure. Then you move under your armpit, lower your arm. Yeah. And then you squeeze your nipples, right? To see what discharge comes out of it. And that is it. That's all it takes to check your breath. Ladies and gentlemen, thank you very much.
Thank you very much, Nurse Khadija. And apologies to us leave. This was on that night. Now we'll call on a representative to give us the importance of early detection.
So, yeah. As care this morning is to talk about the importance of early detection.
Early detection opens the door to future care and treatment. It helps people to plan ahead while they are still able to make important decisions on their care, support needs, and on financial and legal matters. Early diagnosis can enhance quality and length of life through early intervention. Cancer diagnosis at an early stage, especially breast cancer that we are talking about here today, when it isn't too large and hasn't spread, is more likely to be treated successfully. So it's important to seek medical attention as soon as possible. If you notice anything that isn't normal to you, such as a new lump in your breast or underarm, bloody nipple discharge, changes in skin appearance, or your breast is red or has inflammation. So by inflammation, we mean it's hot, you feel hot, it's hot on touch, it's swollen. You need to seek medical attention. Just as our oncology nurse has also said, and news from the other speakers. Almost all women with breast cancer survive the disease for 5 years or more if diagnosed at an earlier stage. Therefore, we must encourage each and every woman to do monthly self-breast examination to increase the chance for early detection. Thank you very much for it.
Hello? We at Paving, we have dedicated partners that will ensure that our fight against cancer does not see us. Maybe this partner is come to an age. We look at our data, we look at our cases, and see how many people for those cases we can help. We can see. This year, we are pleased to announce that we have received support from some of our partners. Our key sponsor every October is Orange Sierra. Orange Sierra is a partner of them. One government publicly today to all their support. And we pay a local support with more funds. Since we are still doing our screening of patients, we cannot here present donations to specific people. We would like to announce a part of the fund that was received from Orange will go towards supporting the surgery. The nominees we identified after the course of our screening exercise in the month of October. And we shall again present to them publicly their check to cover the cost of the surgery. Orange will support local economic surgeries at the end of October. We are also pleased to announce that Irish Aid Sierra Leone continues to be up. This year as well, we will also support 3 surgeries for pregnant compound or children. We are also pleased to announce to you that Chinese embassy has been our partner. They have been very helpful to us. They all what we do. Whenever I welcome them, they are always pleased to come to me. So I'd like to announce today that the Chinese will also sponsor 3 surgeries of the country and the family. We note from the statement of the Minister of Health Representative that as a government, we are trying to put together a dedicated hospital for cancer. That facility, we thought that we're going to have diagnostic center as part of it. Until that happens, we'll continue to pray for diagnosis and treatment for our patients. We want to commend the Access Bank Sierra Leone in supporting this exercise for 2 patients. On the same note, we want to announce here that Child Fund Sierra Leone is also supporting 2 patients for diagnostic and treatment. Again, Collier Solutions have also decided to sponsor 2 patients for diagnostics and treatment. The names of all beneficiaries of these donations will be announced after the close of our second exercise in the month of October. And that will be the time that we do the presentation of checks to provide expenses. We want to thank you all for your support and wish to go in more. Come and join us in our private listeners.
Thank you so much, Dr. Fanny, and a very big thank you to all our partners and viewers. So now call on Dr. Yin to give us a statement.
Morning, the colleagues, and it just feels like time flies so fast. It's like just yesterday I was here attending after years government peak pride. And so this year I'm so glad to see that there is even more plans and more partners coming here. I'm so glad that the second peak foundation has just build even more, expanded even more strong partnerships with so many different organizations like what has been announced earlier, like the foundation and the embassy, and also always strong support from the NHS and Rahman. And I'm really glad that the Thinking Foundation has been it just stage like year by year, day by day, becoming stronger and stronger, helping more and more people. And so that's why we, the Chinese embassy, always fight hard on it. For China, we always attach great importance. Health cooperation is one of the most important economic sector for China and the Sierra Leone friendship. Like everyone knows that we have always been stood together with serving young people during the fight for Ebola and COVID-19. But besides all that, we always for these COVID years, even after the pandemic, we have always have a lot of health provisions going on. Like being successfully conducting the Paving project with the NHS. And it's a very, very successful project which brought healthcare with mobile clinics. I am trying to look at clinics to many remote areas to provide care to people's doorsteps. And also, like we have been partnered with UNICEF and UNFPA. Recently, actually, there is an ongoing project on cervical cancer together with UNFPA. Right now, that's why for health cooperation, we always concentrated on cooperations about women and children care. So like right now, for the cervical cancer project, there is a team from NHS and also from the medical sectors, doctors and nurses. Right now, really in So we indeed have a lot of cooperation going on in the health sector. Culture, human capital, and also opportunity from bring quality care to more people with Chinese technology, Chinese vaccine, Chinese doctors. And also, when I mentioned for our cooperation with Second Foundation, there's always recognition of the Chinese medical team who have been in Sierra Leone for 15 years. This year marks the 15th anniversary of China dispatching Chinese medical teams to Sierra Leone. Right now, there is a team who practice medicine in Chui Hospital. And sorry, one of them, the breast cancer specialist surgeon, should be here, but he's back in China and could not attend today's meeting. But I'm glad to know that he and the Chinese team has been exploring to practice breast cancer surgeries in treated hospital. Maybe in China later on, and we can see that people can receive with breast cancer surgeries through the hospital. Actually, I'm very glad to hear the annual thing all about the great to see that we're going to have a breast cancer special, sorry, cancer special monthly. Indeed, there's a terrific. And we do hope that in the future we can collaboration more with Philippine Foundation, also with MOS, with other health development partners in this area to help more of our sisters and brothers. Thank you. And trying not to and not the speakers. And with that, I know everyone is so eager to attend to the health care for the street. So I'm really honored that you take the right give me this opportunity to announce the opening of the street months. Yes. Thank you. I'm going to
Okay, finally, we will call on the director at being director of programs at being Breast Cancer Foundation, Miss Elizabeth M. Stevens, for the member of the
What love I want to start with you. Good afternoon, everyone. Our distinguished guests, our partners, esteemed partners, Madam CEO, our board of directors, our Black partners, our Orange partners, the OLEA team. On behalf of our CEO, I want to extend our gratitude for leaving your busy schedule to come here today. Sometimes the people like you say, me, I'm not able for one more waiting, for one problem for myself. Better I must study, not a kill me. But thinking they always chase you, like they go after you to know what you need to know to prevent you from further elements. So I want to say thank you for leaving your busy schedule. Those who came to know their status, I want to say thank you for coming to know what you needed to know. So thank you, enjoy your screening process, and we're hoping to see you again. Thank you.
Okay, we don't come to the end of this first session, and we come to the opening scaling session. And we will go register for the scaling, we will get card. One small thing, and we go according to number, please. People already go register weeks ago. So people like today and can register, so now yesterday and can register. So please we go according to number so that everybody gets opportunity and time for seeing different specialists. And thank you.
Okay.